most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Oh, Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to talk about understanding causes of vertigo and effective cure by the Epley Maneuver. It's a home treatment.
That's right.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos to stay healthy, fit, pain free, and we upload every day. Also, boy, at 58, you can crawl like that, Brad.
Oh, yeah.
You can go to, we're going to do a giveaway, Brad, this week, like we do every week. Go to the Bob and Brad website.
Keep talking.
Go to the giveaway section, and you'll see that this week we're giving away a Bob and Brad stretch out strap. We'll probably give away a couple of them.
Yep, it's great for stretching, and there's a lot of different things you can do with it.
It's really a nice one.
It is.
We really want to make sure it was high quality. You can also go to Facebook. It'll be pinned to the top of the page.
Right up there.
Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program.
And remember, we got podcasts out there now, so you can listen to us anywhere you want, in the car or anywhere.
In the shower.
In the shower, yeah. Be careful in there. All right, let's go on with this, Bob.
So what is this is one of the most common causes of vertigo, which is the spinning that you get, dizziness.
Right, and this is relatively, it's not rare by any means. It's not really common, but it's not unusual at all.
I've seen a lot of cases. It's called BPPV.
That's the
short version.
Yep, that's the abbreviation. Benign proximal positional vertical.
Yeah.
And obviously that's why they shorten it up to BPPV. And oftentimes with patients, I just refer to it as vertigo, and a lot of people do, unless we're talking some technical.
I just remember reading in the textbook, Brad, that if you have dizziness, this is going to be one of the most common reasons you have dizziness.
Sure.
Now, there could be many others.
Right.
It could be low blood pressure. There could be medications and such. But
right. So we're going to talk about the Epley maneuver and how to do it. How to actually you can do it at home.
The Epley maneuver is for this specific condition.
Exactly.
Yeah.
Symptoms. So typical symptoms. And now, if you're having this, you'll see if this is consistent with what's going on with you. Is typical dizziness. I've had room spinning. It can make you very nausea, and actually sometimes you can start to vomit because it's that bad.
It's scary.
Yeah.
Actually, I mean, 'cause suddenly you're going to fall.
Right.
And you might feel it when you're in bed, when you turn your head.
Exactly.
And often it is when you turn your head a certain way, like turn to the right, or if you turn to the left. And
right. Some causes this. A lot of it really don't know, but it seems that it can be commonly happen after a bump to the head, some trauma, or after an illness.
Right.
It kind of comes on for whatever reason.
And where does it originate, Brad?
In the ear,
sure.
On both sides, which is rather interesting. The vestibular system is what it's known as, and I'm not going to get into too much of the technical anatomy of it because it just makes your eyes glaze over. But I am going to talk about there's little crystals in there. You always hear about the little rocks or the crystals. They start floating around in this vestibular system and throw things off, and that's where they get that dizziness. And the Epley maneuver puts them back into place.
So that's what my mom meant when she said that you have rocks in your head. So
I don't think so, Bob.
Anyway, so that's the theory anyway, Brad. They really don't know for sure, but that's a pretty good theory.
Right.
And it seems like it works to
this is what I use with patients so that it was very simple. I try to simplify as much as possible. I said, just imagine you got a level. And can you zoom in on this, Tanner?
A little bubble in the middle.
So we've got some fluid in here that would be like the vestibular system, and you've got 3 or 4 loops in there. So we got different ones. But if you turn your head one way or another, like the bubble in there, we want to get it in the middle. That just keeps you upright and balanced. And if you bend over, turn, what happens is the vestibular system sends messages to your brain, which helps you balance and stay upright, and all the wonderful things that the human body can do and stay balanced.
Yeah, and imagine that bubble stays to the right no matter what you do.
Right.
It's not going to work.
Or
And-
I'll mention, like, you got that fluid in there. Just imagine if you had some crystals. I'd like to get some in there so I could be more visual.
Sure.
But we want to get those crystals all the way to one side so that's not interfering with that bubble. If that analogy helps, use it. If not, just disregard that.
Right. Let's go to work, Brad.
That's right.
Let's show how this is going to work.
Okay, so this is called, like you said, the Epley maneuver. This is the maneuver. There's a number of different maneuvers you can do to do this. This is the one I used, I think, 100% of the time.
Sure, I
did
too.
Very successful with it when someone would come in. So I don't know if you want to actually try this one or just do this video, watch this video, so that when you go to a therapist and they do it, you're familiar with how it works.
Or maybe a therapist did it to you already and you want to repeat it, and they said it was okay to repeat it.
Right.
Then go ahead and do so.
Usually, almost always with my patients, after I did it once, I would say, and they felt comfortable with it, and they were alert, and I felt that it'd be appropriate. You can do this to yourself at home tomorrow or the next day if it doesn't clear things up 100%, or you can come back to see me and I'll be happy to do it again. It's very short.
Yeah, and what I found is that we often did the Dix Hallpike Test. I'm sure named after some people again, but that helped you determine which way you're going to go, to the right or to the left.
Right.
So I'm going to show that real quick, Brad.
Sure.
Just so you have the person long sit.
Yep. And you could do this on your bed.
And you're going to turn your head one way and go back a little bit.
But before you we do have these pillows here for a reason. You'll want 2 of them, so there's fairly thick, and you're going to go backwards and
you actually go back
blades
fairly fast.
Yep.
And then you're turning. This is to the left.
Yep.
And I would also do it to the right. And if one of them elicits dizziness symptoms, that's the way you're going to treat it, to the right or to the left.
And that position is exactly, there's 4 different positions you're going to go through on the Epley maneuver. That's the first position. And you want me to jump in there, or should we do it to you?
Yeah, you can do it to me.
I do want to talk a little bit more about some details on that, on the Dix Hallpike maneuver. Is why don't you come back? You want to come back not real slow, as fast as you feel comfortable, but the head extends, in other words, bends back. So that's why we have pillows here, so that your head is back and about 45 degrees to the left. And if I'm a therapist, I'm asking for, are you dizzy or not, and looking at their eyes to see if the eyes are moving back and forth.
That's nystagmus, is when the eyes move back and forth.
Exactly. Obviously, you can't do that to yourself. You can't see your own eyes. Want to come back up?
Yep.
And then let's do the other direction, to the head's to the right, and he goes back, and then Bob says, I'm going to talk for you, Bob.
It's I feel it.
It's worse to the right.
It's got. I feel sick.
Yeah.
So
that means we're going to start position number 1. He's going to come back to that position.
To the right again.
Now, I always have a clock when I do this, and I look at the timer, or I have a digital one, and I start timing. I will go for a minute, and I'll be talking to the person. And if you feel dizzy initially, and it's like, oh, but within 20 to 30 seconds, it's settling down and it's feeling better, then you're good.
That's a good sign.
If after 30 seconds, the dizziness keeps going and it's like you're feeling sick and whatnot, then you got to stop.
Yeah, it could be something else.
Right. You got to go see a doctor. And that's what a therapist would do too. They'd send you to see a doctor. Now, after a minute, and I always go into a minute, although they say now is once it settles down.
Once it settles down.
Right. I always did a minute, and I felt comfortable with that. I felt, let's get those crystals where they belong. Now, head back here. We're going to just rotate, and this is position number 2.
So that was position number 1.
Yep, 1 minute.
This is position number 2.
Yep, and the head's still back. I would say, imagine you're trying to dump the brains out of your head onto the floor. I didn't say that. I said rocks. Going back. But anyway, so your head is back like that. Your hair is pulling this way. Again, after 20 to 30 seconds, usually it would be a little less dizziness this way, but it would produce some dizziness, but not as bad as the first way. But then it'd clear up after 20, 30 seconds. Then you know you're gold when it's completely symptom-free. Now you have to turn slowly to your left side.
So you don't fall off the bed.
Yep. Sometimes I will stand right here.
Yep, that's what I usually do.
Yep.
And the head should stay turned.
Looking down towards the floor.
Yep, down towards the floor.
And angled down a little bit. No, lateral flex to the left.
Oh.
There. Okay. So the head's angling down and you're looking down at the same time. And again, 20 to 30 seconds, things should be clearing up. And then once it's symptom free, or a minute at the most, then you'll go up. And almost always, I don't know about you, Bob, but when I got to position number 3, things weren't too bad. Little bit of dizziness.
If it was helping.
Yeah. Now this is important to get your feet off first, especially if you have a hard time.
I would actually grab their neck too.
Sure, yeah. I mean, and it is nice to do this with a little help with someone. And your head's going to be down. Yep. Chin stays down to the chest while you go up, and then start the clock again, looking down. And this one, I've had people say each position get a little dizzy, but it seems to get a little better as you get from the first one to the fourth one, which is number 4. And once they're down, get your head down. I always have to do that to the patient, head down. So all those crystals are going into the right place in the vestibular system, and we want to keep them there. So bring your head up slowly, and at that point, what happened? Oh, here it is. There's a couple options, but for the rest of the day, and it used to be for 48 hours they recommended, you want to keep your head vertical.
You can look down with your eyes, but don't look down with your whole neck. Yeah. I mean, don't bend your neck down. Yeah. And it's very hard to do that. You're going to try to do it, and that's why we give you a reminder.
Yep. So you could just take a pillowcase and fold it up like this.
You fold it in half, and then you fold it in half again, lengthwise.
There you go.
So, yeah.
If you happen to have, I used to tell my patients actually to get a soft cervical collar. It costs about 10 or 15 bucks with Velcro on. It's a little overkill. You don't need to, but it does work pretty nice. But this works good too.
Yep. You just actually tape it in place.
Yeah. Not too tight.
And it'll remind you that, don't look down like this. Look down with your eyes only.
Right. Right. Now, we've had comments with people. Initially, it was 48 hours to do this.
Right.
And that was like 15 years ago. I read an article from Mayo. And that's what I always did with my patients. And then as research went on, they said, actually, if you do it in the morning, do the procedure in the morning, and you keep your head up until nighttime, you can go to sleep and be fine.
I've heard, you read a lot of different things. Yeah, Brett. And I've read some research that says you don't need to do it anymore. Yeah. I've read some research that says at night you should sleep on a couple pillows, have your head up a little bit. So it's kind of all out there.
I always used to have my patients sit in a recliner with it reclined up or back, so there's back.
They sleep that way.
Yep, and sleep that way. And I actually had them do it 2 nights. And then, recently, in the last 5 years or more, it was, I just go until do it in the morning, and then when it's time to go to bed, lay down in bed. And I've had good success with that.
You definitely need a reminder though, because people would have their head down before they left the room. For me, I mean, and
it's not a big deal if that happens. What happens is the crystals are all home where they need to be. They need that time to settle in and kind of quake. What would you say? Just settle in so they don't move again. When you put your head down, they might come out and get loose. And then all you have to do is do the whole procedure all over again.
Well, I often had people where I had to do the procedure twice in a day, or even 3 times in a day sometimes, until it really felt like it had settled down.
Yep.
And then some people had to come back. But some people, we did it once and they were good and they didn't have to come back.
Right, right. Yep. So there you go.
All over the board.
Is there anything else we want to talk about?
No, I think that's it.
I think it is too, Bob. It's a nice procedure to do. Good luck with it.
It's nice because it works quite often.
It does. It does. Enjoy and stay not dizzy.